Hello, I'm Nancy O'Neill. Joining me on this week's Suncoast FYI, Dr. Ryan Johnson with Integrated Chiropractic, Vladimir Alexander of Alexander Orthopedics Associates, and Jason Sampson, General Manager, and Janet Hansen, Director of Sales and Marketing of the Aloft Hotel. All coming up next on Suncoast FYI. Hello, and thank you for joining us on Suncoast FYI. I'm Nancy O'Neill. Today we're going to focus on your health. Integrated Chiropractic strives to make their patients' lives happier and healthier. Joining me today is Dr. Ryan Johnson to talk more about his profession. Good morning.
Good morning.
Thank you for being here.
Yes, thank you.
So let's start with what's the basic. What is chiropractic?
So chiropractic is the science, art, and philosophy of how the structure of the spine relates to the nervous system. So as a chiropractor, I take a detailed orthopedic, neurological, and range of motion exam. From there, I determine if the patient needs x-rays or MRIs. And at that point, what I do is I come up with a working diagnosis. So once I have that diagnosis, I provide specific adjustments to misalignments in the spine to help relieve pain and dysfunction.
Okay, so basically if somebody is in pain or has an ache or something in their muscles that won't go away, that's when they should come see you? I mean, how does somebody know that you're the person to come see?
Yes, well, typically the number one reason people see a chiropractor or for chiropractic treatment is pain relief. So followed by that, some people have headaches, neck pain, low back pain, mid back pain. So they want to be treated, naturally or without the use of drugs or surgery. It's a great alternative. It's a great option to help with those conditions.
Okay. Now, what are the benefits of chiropractic, and are they long-term, or do some people take longer than others when they start seeing you?
Yeah, it depends. It's a case-by-case basis. So obviously some conditions take longer if they're more chronic. If you've had them for a number of years, they take longer to treat. So typically, though, in an acute case, it can range from anywhere from 1 to 8 visits that I see I've gotten improvements in. Typically longer as well. Chronic individuals may need, up to 10 to 20 visits.
Okay. Now, I went on your website and I see that you do multiple techniques. How do you determine which ones are right for that particular person?
So at my practice, what I do is I look at each patient individually and I assess their needs, their wants, what they come to me telling me. Some people have certain ideas of chiropractic. They're afraid of an adjustment or, what that entails. So I try and be really gentle. I treat people how I'd want to treat my family. So I take all those ideas and I assess the patient and I adjust them based on their needs. So I offer some gentle techniques with some instruments, some blocks, and some traction, but I can also do the traditional manual adjustments with my hands that a lot of patients like as well.
Okay, now what are blocks and...
So blocks are positioning wedges that I use. They're called SOT blocks. So they're used for the low back, for the pelvis, and they help stabilize the lumbar spine and the pelvis.
Okay. And also you do sports chiropractic services as well.
Yes.
What is that?
So my in-laws, they're actually teachers at Riverview High School, so he was a football coach. So what I do is I try and do sports exams for the students, and I also do stretching. I'll do some techniques and physical exams for the student athletes.
Okay, so you get them ready to go back to school and be prepared, right, so that they don't get hurt during their sports.
Exactly.
And one of the other ones I noticed on there was cold laser. Is that something new?
Yes, that's a newer treatment procedure. It got FDA clearance around the year 2000, so that helps with neuromusculoskeletal pain, so sprains, strains to the muscle tears, muscle pulls, so anyone who feels like they've thrown their low back out. It also helps great with carpal tunnel and nerve pain as well.
Great, good. Well, so what's your mission statement? I know that you've always loved holistic health. So what is your mission statement, doctor?
So my mission statement, Integrated Chiropractic, is to help patients live happy, healthier lives without the use of drugs or surgery. So I really want to motivate people to try chiropractic first and then move on if they need other forms of treatment, but at least give chiropractic initial, start and try.
Yeah. And I have been to see chiropractors many times in my life, and it's true, it works. And some people say, well, the first time I went, I didn't feel anything. But like you said, sometimes it takes more than one visit to get things back to where they belong.
Yeah, yeah.
So they have to be patient.
Exactly. You have to be patient,
Okay.
exactly.
Now, I know that you had a recent story that you wanted to share that one of your patients told you.
Yes.
Can you tell us about that?
Sure, yeah. One of my patients had recently told his medical doctor about me and how I had helped him with a severe case of sciatica. So a couple weeks ago, his medical doctor, she's an internist, had given me a call and wanted to personally thank me for helping him without the drugs or the opioids or the hard narcotics, the pain pills. So I was really excited to have another medical professional reach out to me, and she said she'd be more than happy to for her patients for chiropractic care at my office.
That's wonderful, because years ago that was not the case.
No, it wasn't.
Yeah, there was no crossover
No,
before.
there wasn't.
Yeah, so we've made great strides.
Yeah,
Great
it's all for
strides.
the better health of the patient.
Absolutely, that's what comes first.
Yeah.
So where can our viewers go to find out more about you and where you're located? I know you're in the White Herring Wellness Center.
Yes, yeah.
And where is that?
And that is right behind Sarasota Memorial Hospital on off of US 41 at Arlington and Osprey. So we're at 1775 Arlington Street. And you can reach me at my website at srqintegratedchiropractic.com. And the Facebook page would be facebook.com/integratedchiropractic and the number 1.
Okay, and a phone number you'd like to share?
Sure, and you can reach me at 941-487-0266.
Great. Thank you, Doctor.
Thank you.
Thank you for being here.
Thanks for having
Appreciate
me.
it. We're going to stay on the topic of health and wellness. When we come back, we'll move into orthopedics. After the break, we'll talk to Vladimir Alexander of Alexander Orthopedic Associates and how patients' comfort comes first. So please stay with us.